My name is Vinny Mellnick. I am an associate professor and chief of abdominal imaging at Washington University in St. Louis, the Mellnick Institute of Radiology. So the question is, which MRI findings correlate with prognostic changes for rectal cancer? Well, first and foremost, our job as radiologists when looking at an MRI in a patient who has rectal cancer is to determine the TNM staging of that rectal tumor. Each of those stands for a different part of the evaluation. So the first thing we look at is the tumor or T stage. So the thing that we look at when we T stage a tumor is its size, its relationship to the rectal wall and whether or not it extends through the wall, and its relationship to the surrounding structures, meaning does it invade things like the anal sphincters, the bladder, or the lining of the abdomen called the peritoneum. In addition to the tumor's size and location, we're also looking for enlarged or abnormal appearing lymph nodes, not only immediately next to the rectal tumor, but also distant from it. This helps us determine the nodal or end stage. So the more lymph nodes that we see, the larger that they are and the more distant from the tumor, the more aggressive or advanced the tumor is in the TNM staging. The M portion of TNM staging is evaluating for metastatic disease, and we do that by looking not only around the rectum, but in more distant locations such as the liver and the lungs, where colorectal cancer tends to metastasize most commonly. We not only perform these TNM staging tasks at the initial staging or presentation, but also after treatment to determine response to chemotherapy and or radiation. And collectively, this information has a very large impact on a patient's prognosis. Now, in addition to observing things like size, enlarged lymph nodes, and metastatic disease, radiologists look at the tumor itself to find clues about how aggressive it might be. One of the features we might observe on MRI is something called extramural vascular invasion. That's when tumor goes into small blood vessels around the rectum. And when we see it, it can be a marker for a more aggressive tumor and increase the odds that a patient may have recurrent disease after treatment. Another important tumor characteristic we can observe is whether or not a tumor is purely solid or whether it has areas of cystic content or what's called mucin. So mucinous adenocarcinoma can be characterized well on MRI. And it's important for radiologists to mention whether or not this is present because while we're still finding out more about prognosis of these particular tumors, they tend to have a worse outcome than more solid mucinous tumors, and they may have a different response to therapy than the more common solid rectal adenocarcinoma.